Hi, fellow nurses and nursing students. If you are currently at UIC, there's a chance we've met at a recruitment session already. But for those in other parts of the city or the state even, I'm glad you're listening. My name's Kelly, and I'm currently a nurse with my bachelor's degree and in my second year of schooling to become a nurse practitioner. It's a little bit of a long haul, and so right now I'm actually not in clinical rotations, but there's a couple other nursing students in this fellowship who are. We're at very different points in our programs. So I just wanted to start by saying I think what's unique and awesome about the project is you can shape it to your area of interest, whether that be a population or community or something you've learned about in school that you find interesting or unsettling, really. For me, one of those things was the disconnect between the value of advanced care planning and having conversations about end-of-life care and wishes with family and loved ones, but it not happening very often, and there being ethical situations in hospitals and otherwise. And so I was sort of driven by this question of how can I, as a nurse, strive to empower people to think about these things before those types of situations, acute situations, happen. And I've been working with a wonderful organization, Little Brothers, and I've had to completely pivot my project this year so that I'm doing a lot of virtual training and one-on-one engagement with seniors. But I will say that amidst a pandemic, this fellowship is the one thing that's given me quite a bit of purpose. So just a couple other things I wanted to touch on. I know pretty much all graduate nursing students, whether you're in a master's or a doctorate level program, have to complete a capstone project. And while you can't double dip in the sense that you'd be using hours toward the fellowship and also toward a practicum of some sort, I will say, at least for me personally, I feel like what I've learned from seniors and engaging with community members this year and learning about what people care about, how they learn best, what are good methods of communication, all of that, not only I really do believe will make me a stronger nurse and a nurse practitioner one day, but I think it'll even shape my own project. So that's something to think about, that I think this fellowship can really be a continuation and an extension of what you're learning in school if you want it to be. And it really is, whatever you make of it. In terms of balancing school and home life and this project, I'd say it's been a little stressful in a couple of situations, but more than doable. I actually did a lot of planning with my site mentor over the summer, got a lot of really good behind the scenes like content planning done, and then I was able to get some good hours over my winter break, and those were in times where really, in terms of school, I wasn't all that stressed. So I know every student is different. We're all in different programs. There's med students who like to bulk their time in different ways too. And I mean, across the board, like I said, we're all in different programs, but you can definitely make it work as long as you plan ahead and you're willing to think through how it will work for you. And the last thing I want to say is that this really has solidified my passion for community work and helped me grow as a leader, which I think is really important for all of us who are advancing our education. It's made me put myself out there, even email communication, making things a priority, connecting with different professionals, doing, like I said, videos, or even this, like putting myself out there in a way that I don't think I would have just a year ago. And so walking away with that and some new friends and some amazing connections is something I think I will cherish the rest of my life, and I will be very proud forever to tell people about this program. So I hope you do apply. If you have any questions, reach out to the team. You could reach out to myself even. I'd be happy to support you in any way that I can, and I hope that you have a good rest of your month.